Hey, Dr. Tyler Williams at Pinecrest Dental, and you're here today to watch this video because you have some questions about implants and dentures, and you're probably looking for some affordable options for dentures and implants. And so we want to help you guide you through this process. All right, and the main thing to keep in mind is if you're doing full mouth replacement of teeth, you have three main categories. Okay. The first one would be teeth that screw in, okay, and this is where you get a bridge, which is multiple teeth built together as one piece, but they look like individual teeth, and that bridge is screwed into your top jaw or your bottom jaw or both, all right, and it's connected to implants, and it chews and eats like natural teeth, about 90 to 100%, as well as if you had a full set of teeth. So you can pretty much eat everything you like. Corn on the cob, vegetables, salad, meat, all those kind of crunchy foods, things that taste good. You can chew those, and you can chew them well, and when you speak, they don't move. Still takes some time to get used to because your mouth's been without teeth for some time, and now you get these new teeth, and getting your muscles retrained and speaking and your tongue used to it takes a bit of time, but people generally adapt really well, and most people prefer that as the number one option. If you qualify for this option, then that's kind of the Lexus treatment, we would call it. Okay, that's the best option. It's going to cost the most, but it generally lasts the longest and it feels the most natural, and people love it. People who do it almost never regret doing it. I don't have a single patient I can think of in 13 years who's received implants that regretted getting implants, right? In the case that your teeth are too far gone to save, or they're already gone or partially gone, okay? If you have teeth that can be saved, you may not know of a fourth option that we'll go over in just a minute here. But the main three we were talking through is the screw-in options, which are the best, 95 to 100% as well as your real teeth, okay? The snap-in option, okay, and that's where you have teeth that clip in and clip out. So you'll have these anywhere from 2 to 5 titanium implant posts in your jaw, either top or bottom or both. And then you have these teeth that are kind of like a denture, and they clip in and then they clip out between meals or at night. You can take them out to brush and clean there. Okay, those chew about 50 to 75% as well as a full set of your natural teeth. All right, more like 75% is probably closer for the upper teeth, 50% is probably closer for the lower teeth, all right? Our lower jaws are the most difficult to get to chew naturally with something that's not screwed in, okay? So these work well, and they are way better than dentures for most people, but just be prepared that you can probably eat corn on the cob, but it might take a little bit of training to get used to it, okay? And you'll be able to speak with them. The nice thing is when we make these, you won't have the roof of your mouth covered like you would with a denture. Okay, part of it's covered, but most of it's not. And that way, your tongue has more room to speak, and you can taste your foods better and those kind of things. All right. So 90 to 100% on the screw-in, 50 to 75% on your snap-in teeth, and then on your denture, you're going to be somewhere between 5 and 15%. Okay, so there's a big drop down to the denture. Okay. A denture is basically, think about it as an acrylic puck or an acrylic plate that has some teeth on it that are also acrylic. On the top, it suction cups to the roof of your mouth. On the bottom, it doesn't have somewhere to suction cup because your tongue's there. And so that's where, as I mentioned on that middle option, that same concept applies, is people generally have a tougher time with dentures, especially on the lower, because they don't suction in very well, whereas on the top it can suction cup to the roof of your mouth. You don't get that on the lower teeth. All right, some people do fine with just all dentures. Probably 5% of my patients who lose all of their teeth will love their dentures. Okay, Then there's another percentage that, they do it because it's financially the best option, but they just get by okay. And about 3/4 of people with dentures hate them, and usually we're only in dentures for these patients as a transitional teeth for a healing phase, or as the implants are integrating to your bone, those kind of things, and removing you to either a snap-in or a screw-in. All right. So those are the 3 types for completely losing your teeth. You have the Lexus that screws in. Okay. You have the Honda Accord that snaps in. Okay. And then you have kind of your 3-cylinder Geo as the denture. Okay. Now, all of those teeth can look nice, even the dentures, because we do what's called a cosmetic denture. Or there's a couple other ones, a simply natural denture. There's a few different styles, but they look a lot better than your grandma's denture. Okay, but it's still a denture, and you still have to learn to live with it and eat with it, and it's different, especially on the bottom. Some people will have a denture on the top, and they might have screw-in teeth on the bottom or snap-in teeth on the bottom, because then the dynamic is better and easier to get used to. Now, this 4th option that I mentioned that a lot of people don't know about is what we would call partial implants. Okay, and partial implants means we save some of your teeth and then we rebuild around them with implants, and then the teeth that we save, we put veneers on them, and that gives you a nice looking smile as if you had full mouth screw-in implants, but it costs less and the recovery time is so much faster and it feels more natural because we've saved a lot of your teeth. So we can take care of your gum disease. Okay, you get to keep as many teeth as possible. You get a new smile because the teeth you do keep are rebuilt, and you get the ones that are missing replaced with implants. And those are some of my favorite and funnest new smiles to create, because people are just blown away by how good their own teeth can look that they've hated the appearance of, or not being able to chew with well for so long. And it really is transformational. So if you have some questions on which option's right for you, you can stop in the office. We have a book about this, and the book sells on Amazon, but we keep some extra copies in the office, and we'd be happy to share one with you so you can look through it. It kind of walks you through the journey of before implants, what to expect, during implants, what to expect, and then after you have implants, what to expect. And it also educates you on the differences between these options in more detail that we don't have time to cover on this video. So if you'd like a copy of that, please give us a call. We're not trying to sell these books. We do keep a few copies to give away if you're willing to read a chapter or 2 in it and you feel like it would be helpful for you. We'd be happy to share that with you. So thanks for watching this video. We hope it helps you on your journey with implants. We wish you all the best, and leave us some comments below that can help us for future videos answering people's questions about this important topic and life-changing topic. And we'll see you on the next one.